matters, whether you have hypochondria or whether mania is driving it, is because of your next steps. If you truly have hypochondria, if you really are a hypochondriac, you are worried about being sick regardless of your mood state. So whether you're happy, sad, manic, whatever, this hypochondria persists. If you're only ultra focused on illness in a manic state or a grandiosity state or with some specific symptom of bipolar disorder, then it's just the bipolar disorder manifesting itself.
You're listening to Inside Bipolar, a Healthline Media podcast, where we tackle bipolar disorder using real-world examples and the latest research.
Hey everybody, and welcome to the podcast. My name is Gabe Howard, and I live with bipolar disorder.
And I'm Dr. Nicole Washington, a board-certified psychiatrist.
And we continue to get your emails. Remember, if you have any advice for the show, good or bad, or a topic suggestion, hit us up at show@psychcentral.com. We really appreciate it. And I promise we are reading all of the emails. Now, one of the emails that we got is somebody asked if hypochondria can be related to bipolar disorder. And I got to tell you, I don't know. Even with all of the research that I have done on this show and our pre-recording conferences, Dr. Nicole, there's still this little piece of me that's like, I don't know. Are they really related? I'm curious from a medical perspective. Hypochondria, bipolar disorder. Is hypochondria a symptom of bipolar disorder?
Not a symptom of bipolar disorder, but you can have more than one mental health diagnosis. I mean, you can have bipolar disorder and generalized anxiety disorder. You can have bipolar disorder and obsessive compulsive disorder. You can have bipolar disorder and PTSD. You can have bipolar disorder and illness anxiety disorder, which is kind of the new hypochondriasis.
Hypochondriasis? Wait a minute. What? Now that's that big word alert. What is hypochondriasis?
We'll leave it at hypochondria. That's fine. We'll leave it there. We'll leave it there.
Wow, you got to pull out medical school learning. What are you doing to me here?
We'll leave it there. It's fine. We'll leave it at We'll leave it there. We'll leave it there.
All right. Leaving it there. So one of the first things that I thought about hypochondria is it's a worry. It's a worry that you are sick, right? Or could become sick or are more vulnerable to being sick. And I can certainly see how bipolar disorder, things like grandiosity, things like mania, even spots like depression and anxiety, all of those things can make you very vulnerable to being worried about things that can happen. And also, not to fall too far down this rabbit hole, if you have an anxiety component to your bipolar disorder, which we know can exist comorbidly, people are fearful of panic attacks to the point of not going out in public for fear of having a panic attack. There is a lot to unwrap here, and I can certainly see how one might drive the other, because let's face it, bipolar disorder hijacks a lot of reasonable thought processes and turns them abnormal.
It does. It can, for sure. But Gabe, is that worry when you're manic and you have all of the racing thoughts and the flight of ideas, and you might have a person who during their mania is super focused on, I have a disease, and they're spending all night long when they're not sleeping, because remember, they don't need sleep, and they're on the internet all night doing research on a disease process. I mean, I guess that could look like illness anxiety disorder. That could look like somebody who thinks they have something that they don't have. But I don't know if that's in the same category. Like, is it a worry about it in that sense? Or is it related to mania? I guess it would all be determined by timing, when it happened, what other symptoms were going on. If a person had illness anxiety disorder, I would expect that to be a little bit more consistent and regardless of mood state. Whereas if you only have this preoccupation with having a disease when you're manic, then I would say that's not hypochondria. That's not illness anxiety disorder. I would say that is your bipolar disorder.
One of the things that I'm really trying to tease out is I really do think that people with bipolar disorder have a real need to be more aggressive. So many things that happen to us are sort of ignored. We complain about side effects of medication and we're told it's for our own good. We talk about, panic attacks and anxiety attacks being disruptive and embarrassing. And we're told, well, that's part of the process, learn a coping skill. We see symptoms of mental illness that mirror symptoms of physical illness, and we feel very strongly that, hey, we're having a physical reaction, and somebody's just like, no, 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 you're bipolar. That's what people with bipolar disorder do, which is true. That could be. The very specific example that I have is I have panic attacks. And here's what panic attacks look like. I get a little blurry vision. I get lightheaded. I get disoriented. I break out into a sweat. My heart starts racing. Now, here are the symptoms of a heart attack. You get lightheaded. Your heart starts to race. You break out in sweats. You can't. I mean, they just mirror exactly. Now, I have had panic attacks for years, but one of these days I'm going to have all of the symptoms of a panic attack, but it's actually a heart attack. And I do believe that I will recognize the difference. But you know, the sweaty ball of word salad who is saying I'm having a heart attack is going to look exactly like the sweaty ball of word salad who has had dozens of panic attacks over the ensuing decade. So what is a patient supposed to do? I really don't think that the medical community takes us seriously to the point where our only choice is to be ultra aggressive.
Okay, well, first of all, you said that one day you're going to have all the symptoms of panic and it's going to be a heart attack. So let's not put that out into the world.
Okay.
Let's not
Fair
put that
enough.
out.
Clean it up, clean it up, clean it up.
Let's
Dr.
not
Nicole,
put
use
out
that medical degree.
Let's not put out into the world that you're like, yeah, I'm going to have a heart attack one day, and y'all are going
That's
to
very
think it's
fair.
panic, and I'm going to die. Like, let's not
Very
go
fair.
there. Let's
Very fair. Just an analogy.
let's bring
Just
it
an
back.
analogy
Let's bring it back
to
a little
illustrate
bit.
what I'm saying.
Let's bring it back a little bit.
Yes.
But it is important. It is important for you to know, what are my panic attacks normally like? And when something changes, it should be looked into, especially if you've reached a certain threshold of age, especially if you have that family history. But if you start to have symptoms that are different than your norm and you think, oh, that could be something else, there's absolutely nothing wrong with you presenting to your primary care, even the emergency room, if you genuinely think you're having a heart attack. We'd much rather you err on the side of caution and show up to the ER and say, oh, I have panic attacks, but I never have had radiating pain down into my arm, and I don't typically have sweats with my panic attacks. I'm having this. I'm a little bit concerned it could be cardiac in nature. Work me up. And they will gladly work you up. They do it all day, every day.
You know, I want to give a little pushback on the they will gladly work you up, because I do wish that it would work that way. And frankly, it should work that way. But, you know, people with severe and persistent mental illness aren't always taken seriously. And in fact, there's a story, Rachel Starr Withers, who hosts Inside Schizophrenia, a Healthline Media podcast.
Rachel's fabulous. We love her. She's amazing.
Fabulous show. She is incredible. Several years ago, she showed up at the emergency room because she was having skin lesions. And she said, hey, I'm worried about this. I'm concerned. And they said, oh, well, you're doing that to yourself. And she said, no, I'm not doing that to myself. And she said, well, it's attention seeking. She said, it's not attention seeking. You're like, look, you know, we know that you have schizophrenia, and we don't think that you're doing it on purpose. We don't think that you're bad. They're very compassionate, but they just would not take her seriously. As it progressed and got worse and worse and worse, you know, she started to do what anybody in her situation would do, and well, frankly, Google shit. And she became concerned that she might have a flesh-eating bacteria, or just, you know, her mind just went in all of these directions, and nobody would test for anything. They refused citing schizophrenia. So Rachel, a grown woman, an adult woman, got her father and insisted that her father come and demand this test on her behalf. And she was diagnosed with a flesh-eating bacteria. She was quarantined for 30 days. She still has it. She still manages it. She was right all along. But nothing this woman could say could get her the care that she needed, because nobody took her seriously because of the schizophrenia. So
that happens every day. That happens every day.
It happens constantly. So
it does.
I'm curious about the reason that somebody is tuning into this show. Are they tuning into this show because they think that they're overdoing it, and then they hear this story and they're like, nope, need to get the workup? Or are they worried that they're not pushing hard enough and want a reason or permission to push harder? What are your thoughts of those two directions?
So I have had patients all the time go to the ER, go to their primary care doctor, and they come back. And I know for sure these things were happening because I used to work in a program where we had staff that would accompany people to the ER, would accompany people to their doctor's appointments to help advocate for them when they were having physical health things going on. I've gotten the stories back from my staff of the person who went in for a complaint that would typically require a physical exam, and the doctor never touched them. Because they just were like, oh, this person's severely mentally ill. It's probably their illness. And they were written off. That happens every day. So as I hear that story, there are a couple things that pop into my brain. One is there's not an ER in this country if we're going to go down the chest pain route. You show up first time and you say, hey, I'm having chest pain. Heck, you show up second, third time. Chest pain is one of those things. You're going to get worked up. No ER is going to turn you away and say, oh, you're having chest pain. It's all in your head and send you away. The workup may become less and less. The first time you may get the full thing. You may get all the testing done. The second or third time, they may say, okay, you were just here last week and the week before that. We gave you Ativan and your heart attack symptoms went away. Not a heart attack. We're very confident this is your anxiety. But if you keep showing up, they are probably going to keep working you up to some degree because that's a big deal. So I think it's important that if it's something big, don't not go because you think, oh, they're not going to believe me anyway. You go. Like you go and you say what you need to say. I do think though sometimes when you're in a panic attack or you're having symptoms of a heart attack, that anxiety kicks in. Sometimes you think you're saying, I normally have panic attacks, but I normally don't sweat or I normally don't have pain in my arm with a panic attack. I'm concerned I might be having a heart attack. That is, you think that's what's coming out of your mouth, but what really is coming out of your mouth is, I need you to work me up for a heart. I'm having a heart attack. I'm certain I'm having a heart attack. And they're going to be like, do you have anxiety? Yes, I have panic attacks. I have panic attacks. But you're not able to say what you need to say. If you can have somebody with you, have somebody with you. If you can get those words out, try your best to get those words out.
There's misunderstanding on the patient side and there's misunderstanding on the medical side. And I think it's important that we keep that in mind moving forward because so often it's all doctors suck or all patients are lying. And I don't think that's a good way to have a conversation. One of the things that I've always liked about doing this podcast is that it gets both point of views out there. Please keep that in mind for my next question because it's going to sound like I'm accusing you and I'm not. But let's continue with the Rachel Starr Withers example. It really was an astronomical odds that she actually had a flesh-eating bacteria. What incredibly bad luck. It's like winning the lottery at this point. So let's say that Rachel's story would have gone differently, that it wasn't flesh-eating bacteria. There was still an issue, but it wasn't this definitive test that she could get and immediately being taken seriously. They would have said, well, we told you didn't have a flesh-eating bacteria. It's definitely your schizophrenia. We're not going to look into this. You're still picking at your skin. She's like, I'm not doing that though. And then we get into this and this is where the medical system has a lot to answer for, I feel, because the physical doctors are going to tell her to go to the psychiatrist because these are part of your mental illness.
And I'm absolutely going to say, hey, I don't do rashes. You need to go see somebody else.
Yeah, I don't do rashes. Right. So, and then you're just going to ping pong these patients until they have no choice.
Oh, yeah.
And somebody is going to say, well, you're just a hypochondriac. There's nothing wrong with you. This is just your bipolar disorder. There's nothing wrong with you. You're making this up for attention. There's nothing wrong with you. And in the meantime, there is absolutely something wrong with you that nobody wants to investigate.
Yeah.
How do you even begin to tease this out? Because the minute you say this patient is a hypochondriac, everybody quits. Everybody quits, rolls their eyes, and stops taking them seriously. And it's over for them.
It is over for them. And that is the unfortunate part. I think the way you tease it out is consistency. Is having a doctor that's yours that gets to know you, a good one who listens to you, which is why I'm always preaching to people who have bipolar disorder, people who have schizophrenia, really anybody, but especially my folks with severe persistent mental illness. I'm like, hey, you need a primary care doctor that is yours. You need somebody who knows you. They know your quirks. They know the things that you worry about on a regular basis, and they know when those things change. And there are good ones out there. It just does require a lot of work, I will say, because you're right. Once people have it in their head that you have illness, anxiety disorder, or, oh, you have schizophrenia, and one time 20 years ago, you had a hallucination of something crawling on you, you can't come back and say anything about your skin without somebody finding a record from 15 years ago where it says that you had these tactile hallucinations and you thought bugs were on you, and they put it on you forever. That is really hard. The only way these things ever get teased out is time and consistency. Like that is the only way that you're ever going to be able to tease these things out, because in Rachel's case, I'm sure somebody could have said, "Oh, Rachel's got illness anxiety disorder. There's nothing wrong with Rachel." Or they could have said, "Oh, Rachel has factitious disorder where she's doing it to herself." Or they could have said, "Rachel's malingering. She's trying to get something out of it." I mean, they could have said 50,000 different things about oh, it's just her psychosis and she's just not stable. They could have said a lot of things, but the only way you get to the bottom of that is time and consistency and having somebody who is your person. That's why you need your person.
Just out of curiosity, Dr. Nicole, how often does bipolar disorder and illness anxiety disorder co-occur together? Are a lot of people with bipolar disorder hypochondriacs? And we're back discussing hypochondria, now known as illness anxiety disorder.
We don't have a lot of firm data. There's not a ton of research looking at both bipolar disorder and hypochondriasis, or bipolar disorder and illness anxiety disorder. That there just isn't a lot of data out there about the two coexisting together.
It really seems like it's one of those situations where enough people are worried about it that it tickled the internet algorithm to get health websites to publish articles about it, but it doesn't occur enough or is debilitating enough that people are studying it or have quantifiable data on it. So we know that in the patient community, there must be some sort of issue, but figuring out how big of a problem it is left to basically just asking people like you, how often do you see it in your practice? And apparently you don't see it very often.
I don't see it very often. And that is definitely not to minimize anybody's personal experience. It's just not something that I see a lot in my practice. And, why might a psychiatrist not see a lot? One, is largely happening in the primary care space. A lot of times people with illness anxiety disorder are not going to see a psychiatrist. Maybe they're in therapy and not necessarily seeking out treatment with medication. So maybe they're just not getting to me. Two, it could be that they're just not telling me about those things, or those frequent primary care doctor appointments. I can honestly say I don't ask people frequently, when was the last time you saw your PCP?
I think it's really important to take a step back for a moment and talk about what hypochondria is and what hypochondria isn't. And one of the reasons that I feel this is so important is because if you know somebody who is sick and you don't want to go to that person's house, you're not a hypochondriac. You're just trying to avoid illness, right? And people have different levels of, some people are just like, screw it, we'll get together. If I get sick, I get sick. I can be down for a couple of days. I don't care. I've got a great immune system. I drink protein shakes, and I'm a runner. I don't know. I'm losing my place in the analogy, Dr. Nicole, but you understand my point. But other people become fearful. They won't go outside if the weather is below a certain temperature, or if they hear that there's a 1% spike in flu outbreaks, they won't go to the grocery store and buy food, even though it is detrimental to them. Am I describing this accurately?
To a degree, yes, Gabe. You're in the ballpark. You're in the ballpark. When a person has illness anxiety disorder, they are anxious about illness. I mean, I think the new name pretty well encompasses what we're dealing with here. They are anxious about illness. This is a person who has intense health anxiety. There may be nothing there, and they just have this constant worry about their physical health and about their overall well-being. This may be somebody who goes to the doctor a lot because they always think something's wrong with them. I think we have people in our lives like that we can conjure up a picture of. Sometimes they can misinterpret just normal body things. I mean, as we reach a certain age, sometimes random crap just happens to your body and you can't explain it, or you get a random ache or a random pain or a noise that your stomach didn't used to make, or something. And then all of a sudden, if I have illness anxiety disorder, I may become very, very concerned and worried that is something more serious. And then there's the cycle of me going to the doctor more often and trying to figure out what's going on. But with illness, anxiety disorder, when you have those symptoms and you are concerned about these illnesses, you don't find anything in the workup.
One of the things that I think about to make sure that our listeners understand this correctly is the number of people who are, perfectionists that say, "Oh, I have a little OCD." No, you're not. You're just organized. You may be very organized. You may be meticulous. You may be a perfectionist. You may be an annoying perfectionist. But no, you don't have obsessive compulsive disorder. So if you are one of these people who is worried about being sick, maybe more so than your friends, that doesn't mean that you have hypochondria. It doesn't mean that you're a hypochondriac. It just might mean that your tolerance is set differently. And not to belabor a point, but tolerances are set differently for everything. One of my friends loves to go skydiving. She's like, I want to go. I'm terrified of that. I'm afraid she can tell me it's safe until she's blue in the face. But I will ride a plane. And I have other friends who are like, I'm not getting on that death trap. You're putting me in a metal tube and shooting me through the air. So there's tolerance levels. When does it cross over? When does it become, it's not just a preference or a tolerance level or a risk averse equation? When does it become an anxiety? When does it become a psychiatric issue that Dr. Nicole needs to get involved with?
Yeah, when you get to the point that it's distressing, where you are experiencing significant distress. If you get a random muscle twitch and all of a sudden you think that you have some rare neurological condition and you're concerned and you're going to your primary care doctor repeatedly, maybe you're at the point where you fired a couple primary care doctors because nobody's taking you seriously, and you're doctor hopping. If you're at the point where you're seeing several different doctors and you're getting the same answers, you have to at least consider, what is this? What's going on? Now, on the other side of that, we all have stories of people. We all know people who have had something wrong with them. They were not getting answers, and they persisted, and they kept persisting. And then eventually somebody said, "Oh yeah, like you do have this thing." And they found it out down the road after a lot of heartache, a lot of being poo-pooed by doctors. So I'm not saying that you should just give up and blindly follow everything that's being said, but really, it's the anxiety that we're worried about. That's where the distress comes in. If you have actual physical health, something going on, something happening in your body, and you say, no, something is happening in my body that you can point to, absolutely advocate for yourself. Keep going. But with this disorder, the big thing is it's the anxiety. It's not the little muscle twitch that's distressing you. It's the anxiety that you feel. It's the worry that you can't let it go and you can't stop thinking about it. That's what's disruptive. It's not the actual physical symptom, because there actually may not be a physical symptom at all. And if there is, it may be just a normal variant of your normal body function.
As I think about what you're saying in my head, Dr. Nicole, I think about the stereotypical journey with bipolar disorder. Oftentimes, people with bipolar disorder recognize that something is off. They don't necessarily think it's a mental illness. They don't even necessarily think that it's a medical condition, but they do think that something is off, wrong, incongruent. They feel different from the people around them. And we reach out to people and we express this, and we get shut down. We get told that nothing's wrong, nothing's going on. And unfortunately, as we know, bipolar disorder is more often than not diagnosed in crisis. Something has gone terribly wrong, from the extremes, a suicide attempt or an arrest, to the less extreme but still equally scary, being admitted to a psychiatric hospital, to even mid-range, like quitting your job suddenly and refusing to leave the house or dropping out of school. Something really, really serious had to happen before anybody took us seriously. So I can see where, using that as a foundation, people with bipolar disorder must be particularly vulnerable, because when they say, "Hey, I feel like something is off in my body," and everybody around them is like, "Oh no, you're fine. You're just a hypochondriac." They're like, "Ah, wait a minute. I've heard this story before. So now I have to wait to crisis to get medical care," because that is more often than not what happened to a lot of people to get to a psychiatric diagnosis. Do you feel that this plays a role here?
I don't know that I've ever thought about it in that way. I don't know. I mean, I just really don't know that I've ever thought about it in terms of a person with bipolar disorder being ripe for something like this brewing because of their previous experience with bipolar disorder. It's not what I've seen in practice. It's not what I've seen play out. And I do think largely that's because the illness anxiety disorder symptoms are physical health worries, they're physical health concerns. And maybe my patients just aren't telling me about their physical health because they think, oh, Dr. Nicole doesn't care about my muscle twitches. She doesn't care about that. She only cares about my mental health. Maybe they're just not telling me. Maybe that's why I don't see them coexist a lot together. I mean, anything can coexist together. I'm just not seeing it a lot. And I will say, as a psychiatrist, I don't generally see a lot of people with illness anxiety disorder. A lot of these patients are not showing up to see the psychiatrist until their cases are much more extreme and much more severe.
That's really interesting and adds a whole other layer to this, right? Because you're treating them for their mental health. They see hypochondria as their physical health. I would say that the average person probably doesn't believe that they have hypochondria at all. So there's a lot of denial, which we know how that plays out over on the mental health side. But what does that look like on the physical health side? And as we've talked about before, in all mental health advocacy, everywhere, always, we separate out mental and physical health. So how does this ever get resolved?
It's tough. A lot of times, Gabe, these individuals do a lot of doctor hopping. So I'm not happy with the answers I'm getting from Dr. A. I'm going to make an appointment with Dr. B. Oh, Dr. B is just like Dr. A. I'm going to go see Dr. C. All these doctors are the same. I'm going to go see Dr. D. And then the patient ends up looking, I don't want to say shady, but I think there
But
is
to
a,
a doctor, they probably are perceived as shady. You're answer shopping. You're trying to get
yeah,
the result that you want, despite the fact that it's not
yes.
true. Or, I mean, isn't it like call a spade a spade? Like, isn't that true?
Nah, I mean, I would say no. I mean, I would say no. So it's not like they're seeking drugs or they're trying to feed some addiction process by going from doctor to doctor to get controlled substances or anything like that to raise an eyebrow. I think the eyebrow should be raised in, I wonder if this person has illness anxiety disorder or one of the other disorders, somatic symptom disorder. Like what if this person has that? That's where my eyebrow gets raised. So when they get to me, it's because they had a very they've had a very, very topsy-turvy path, and they do end up with a primary care physician who says, "You know what? We've done the workup. You've had the $1,000,000 workup. There's nothing there. I really want you to consider seeing a therapist." And maybe they go see a therapist, and then the therapist says, "You know, your anxiety about this is so intense. I think you should consider seeing a psychiatrist." That's when they get to me.
Dr. Nicole, obviously we've bounced around a lot. We've covered a lot of ground, and I'm just trying to summarize all of this for our listeners to give them some sort of takeaway. If you suspect that you have hypochondria or somebody that you love has hypochondria, which is now called what's the name that I'm not getting right? Illness anxiety disorder?
Illness anxiety disorder. Yes,
Illness
yes.
anxiety disorder. See, we're near the end of the episode and I'm finally using the correct terminology, right? But if you suspect that you or a loved one has illness anxiety disorder, what's the first step to getting treatment or to getting help?
I would say get in to see a therapist. That's the first place I would start. I would start in therapy. I would start with someone to help you process through what is this disorder, what's going on. Your therapist may then say, I think you should consider talking to a psychiatrist. Maybe medication may help. Maybe there's a lot of anxiety going along with this that we can address with medication and therapy. I think if you start with a therapist, that's a good place to start.
And is treatment available? What's the outcome for people who are diagnosed with this to lead normal lives and not worry that they're constantly sick?
Yes, treatment can be highly effective for this disorder. I think sometimes people with disorders like this, they want to never have the concern that something's wrong, and that may not be where you land. You may land that you always will have random thoughts of, "What is that? My muscle twitched. Is this some rare neurologic disease?" I think where therapy takes you is it takes you to a place of being able to reassure yourself and say, chances are that's not what this is. Chances are that's just some random something. It's never happened before. It's not something to be worried about. It's for you to be able to work yourself through it without developing the extreme anxiety, which is the problem. It's not the having the physical thing happen or even that initial thought. It's how do you manage that initial thought?
Dr. Nicole, thank you so much for your time today. And again, we've just been all over the place because I think that hypochondria is all over the place. Some people are being labeled as hypochondriacs who are legitimately ill. And some people are not being labeled hypochondriacs and are answer shopping and doctor shopping and emergency room shopping until they hear what they want to hear. And I think that both are equally disturbing. And I know we're near the end of this podcast. In fact, we're at the end of the podcast. And all I can really say about this is, wow, this just seems like such a burden for people with bipolar disorder to have to manage these two things together.
Whoever you are, bipolar, not bipolar, you need a primary care doctor. You need somebody that knows you. You need to make sure you're taking care of all those health maintenance things. You need that person that you can talk to when you're having these physical health concerns that may be interfering with your life, or if you're having anxiety about these physical health concerns. Those are all things you need to be able to talk to your primary care doctor about. You can't do that if you don't have a relationship with them. You need a relationship with the primary care doctor.
I could not agree more. In the meantime, Dr. Nicole, if you can convene the Council of Doctors and have them be more accepting and understanding and finally agree that mental health and physical health live in the same body and that maybe we should stop separating the two out, I would appreciate that. I have to assume that you meet probably at some pharmaceutical company's headquarters on your like tennis courts and your yachts.
I'll just send it in the group text that I have with all the I'll just send it there. How about that?
I love that. And what we also love is all of you listening in. Thank you so much for being here. We need a couple of favors. First, wherever you downloaded this episode, please follow or subscribe to the show. It is absolutely free and you don't want to miss a thing. And hey, do us a favor. Recommend the show to all of the people that you know. Share your favorite episodes on social media. Bring it up in a support group. Send somebody an email or a text message. Tell everybody you can about the Inside Bipolar podcast. And my name is Gabe Howard, and I am an award-winning public speaker who could be available for your next event. I also wrote a book. It's called Mental Illness is an Asshole and Other Observations. You can get it wherever they sell books, but if you go to my website, you can get a signed copy with some free swag. That website is gabehoward.com.
And I'm Dr. Nicole Washington. You can find me on all social media platforms at Dr. Nicole Psych or at my website, drnicolepsych.com.
And we will see everybody next time on Inside Bipolar.
You've been listening to Inside Bipolar from Healthline Media and PsychCentral.com. Have feedback for the show? Email us at show@PsychCentral.com. Previous episodes can be found at PsychCentral.com/IBP or on your favorite podcast player. Thank you for listening.